Millions of Americans have applied for a job, got a job offer, and had to go take a drug test. And most folks that have taken a drug test have never heard of the term medical review officer, or MRO. Let's learn what is an MRO. Joe Reilly, President of National Drug Screening. I want to talk to you today about the role of the medical review officer, or MRO, in the drug testing process. You may have heard of an MRO. You may have talked to an MRO. Most of you have never heard of it and have never talked to one. So in the drug testing process, as you know, traditionally, we collect a urine specimen. It goes to the laboratory for testing, and the results then go to a medical review officer who reviews those results. And there's a process which I'll explain. And then those results go to the employer to make a decision about hiring you for the job because you have a negative drug test. And most folks will have a negative drug test. So in the process, when the lab gets the specimen, they do an initial screen. If the initial screen is negative, they report it immediately to the MRO. The MRO looks everything over and reports it immediately to the employer. It's negative. We're good to go. You get hired. You keep your job. When you have a non-negative screen at the lab, it goes over to another section at the lab for what's called confirmation testing, or GCMS, gas chromatography, mass spectrometry, and it pinpoints the exact metabolite, the exact drug that's in your specimen. And those non-negative results now go to the medical review officer, or the MRO. And so you might be positive. I say you might be because, well, if you snorted cocaine, you're probably positive. But if you took codeine because you have chronic back pain and you have a prescription for codeine, you're positive at the lab, but you're not going to be positive when the result gets to your employer. Because a big function of the medical review officer, or MRO, is when they have a positive, they're going to call you and talk to you about it. And it's going to go something like this. I've got your drug test result from your pre-employment drug test at ABC Company, and it's positive for opiates, specifically codeine. Is there any medical explanation for that, or do you have a prescription for codeine? And you might say, yes, I have a prescription for codeine. I have chronic back pain. And the MRO will say, okay, that's good, but I need to verify that. I'm going to need your pharmacy name and phone number, and I'm going to need your prescription number. And I'm going to verify that, and if it all checks out, your employer is going to get this drug test result back as a negative. But if it doesn't check out, and you don't have a prescription, your employer is going to get this drug test result back as a positive. Now, every drug test result that came out of the lab as a non-negative goes through the same process with the medical review officer. That includes marijuana and cocaine positives. Now, there's no medical explanation for cocaine. There aren't any dentists around anymore since the 1920s that use cocaine to numb you up. So there's no medical explanation for the use of cocaine. But you still go through the same process. Marijuana, you might have a medical marijuana card. You can tell the MRO that. They'll note that on your result. It's still going to be positive because you were positive for marijuana. It's going to be up to your employer's policy what they do when you have a medical marijuana card. People say sometimes, I have a prescription for marijuana. Well, no one has a prescription for marijuana. States issue a medical marijuana authorization or a card. Doctors don't write prescriptions for medical marijuana. They authorize the use of medical marijuana. You don't go to CVS or Walgreens to get your medical marijuana. It's not done with a prescription. Now, the MRO, the medical review officer, is a licensed physician, but not just any licensed physician. It's one that's been trained and qualified to know what drugs might cause a positive for what drugs at the lab. So they get certified and they go through qualification, retraining every 5 years. They also need continuing education. We often call the MRO as the gatekeeper in the drug testing process. And the MRO is advocating that everything went correctly. The lab did its job, and the result is correct. The I's are dotted, the T's are crossed, and they deal with your medical prescriptions so you don't get a positive at the employer, and it was because of a legitimate prescription. Now, it has to be a legal, legitimate prescription, because if you say my back was hurting last night and I took my wife's codeine pill, that's not correct. You cannot do that. That's a positive drug test, so be aware of that situation. So at National Drug Screening, you can learn more about the MRO and the process and how it all works on our website at nationaldrugscreening.com. Just put MRO in the search bar by the magnifying glass on our website. You learn all about the medical review officer. We have 5 full-time MROs that work with all the drug tests that we process, a couple of thousand a week. And our MROs are full-time. They don't have a practice. They're not seeing patients. So we get fast turnaround time to our employers. And our MROs are connected electronically to the laboratories. Our MROs work in our same reporting system so that an employer gets results very quickly. You might have an MRO that's also your local physician, and they're seeing patients all day long, and the drug test results are sitting on their desk. You're not going to get quick turnaround time when you use an MRO that also sees patients. So with our MRO service, again, you have 5 full-time MROs. You have over 80 years of MRO experience. Our chief MRO, Dr. Nan, has been doing this for 20-plus years. We have 12 MRO assistants that assist the MROs with the administrative portion of the process. We have software integrations with our employer clients and with the major SAMHSA certified laboratories that we use, including Quest Diagnostics, LabCorp, Alere, Clinical Reference Laboratories, or CRL, MedTox, and others. If you're not using an MRO in your drug testing process, look out. You're going to have liability concerns. If you're doing instant testing and not sending those positives to the lab for confirmation and then MRO review, look out. You're going to have liability concerns. If you fire somebody based on an instant drug test that didn't go to the lab for confirmation and didn't go to the MRO for appropriate review, and that person sues you, you're going to lose the lawsuit. So the medical review officer, as the gatekeeper in the process, advocating for the employer, the lab, and the donor, is a big part of the process to avoid liability check us out at nationaldrugscreening.com. Give us a call, the number on the screen, and we can help you get set up with an MRO, medical review officer, service for your drug testing program.